Around 2.5 million people in the UK have type 2 diabetes. Diabetes is a condition where the level of glucose or sugar in your blood is too high. Remember, the sugars that become glucose in your body are in lots of foods, not just sweets. Even some fruits are high in sugar, like dates. Your condition, type 2 diabetes, means that a large gland in your digestive system, called the pancreas, doesn't produce enough insulin, or that your body doesn't respond to it in the right way. This can make your glucose level too high. The condition can be improved with a healthy diet and increased physical activity, such as swimming or going for a walk every day. At least once a year, your doctor or nurse will check, among other things, your HbA1c level, which indicates your blood glucose levels for the last 2 to 3 months. If diet and exercise alone are not sufficient in controlling glucose levels, then medication may be needed. Your doctor will decide the best treatment for you. Remember, because type 2 diabetes is a long-term condition, your treatment may need to change over time. However, if you make the right changes to your lifestyle, your condition can be better managed. Diabetes is a serious condition and needs to be properly treated. This can involve medicine, but you also need to lead a healthy lifestyle to manage your condition. Eat 3 well-balanced meals every day, making sure your diet contains 5 portions of fruit and vegetables, some starchy carbohydrates such as bread, rice or pasta, and a minimum amount of fat, salt and sugar. Useful changes to your diet can be as simple as grilling food instead of frying it, using olive oil instead of butter when cooking, eating wholemeal pasta instead of white pasta, or eating whole grain bread instead of white bread. Exercise lowers your blood glucose levels and helps your body use glucose efficiently. Exercise for 30 minutes a day on at least 5 days of the week, even if it's just taking the stairs instead of the lift, or walking to the shops instead of driving. If you're not used to exercising, split your physical activity into 10-minute sections. Set yourself weekly targets. Most importantly, find an activity you enjoy. Make sure you take the medicines your doctor or nurse has prescribed. Even though diabetes cannot be cured yet, if you make the right changes to your lifestyle, it can be better managed. You have been prescribed Onglyza because you have type 2 diabetes. It is a prescription medicine that is used in combination with other medicines, usually metformin, because your first medicine wasn't controlling your diabetes. Your doctor may have chosen Onglyza for you because you were worried about weight gain or hypos. Your diabetes medications, along with a healthy diet and increased physical activity, help control your increased levels of blood glucose throughout the day. You might not feel as if the pill is doing anything, but it's important that you keep taking it as your doctor or nurse has told you. They will be able to tell if Onglyza is working for you by doing a blood glucose test at your next checkup. Take Onglyza once a day at any time, with or without food. If you forget to take a dose, take it as soon as you remember. However, if it's nearly time for the next tablet, skip the one you missed. Never take 2 doses on the same day. When you eat, your digestive system breaks down food into glucose. Your pancreas then releases insulin to carefully control how much glucose is in the blood. When you have type 2 diabetes, your pancreas doesn't produce enough insulin, or your body cells can't use the insulin properly. This can result in your blood glucose level being too high after eating. Onglyza, when added to your existing medication, helps your body increase its insulin levels after eating, which can result in lower blood glucose levels after meals. If you want to know how it works in your body, ask your doctor or nurse for a leaflet. Hypoglycemia, also known as hypo, is something that can happen in people who take certain kinds of diabetes treatments, like insulin or diabetes tablets. Some diabetes medications result in a lower risk of hypos than others. Some symptoms of low blood glucose include feeling hungry, sweating, going pale, or a fast heartbeat. Treating a hypo is usually very simple. First, have a small amount of sugary food or drink. These are quick-acting sugars. They should be followed with some slow-acting carbohydrate, or the next meal if it's due. As a result of taking diabetes medications, you might have side effects. If you have allergic reactions like a rash, hives, or swelling of the face, lips and throat, stop taking Onglyza and call your doctor. Other side effects of Onglyza can include headaches, upper respiratory tract infections, and urinary tract infections. If you notice anything unusual, you should tell your doctor or nurse. But remember, not everybody taking Onglyza experiences side effects.